all to CCMB virtual panel discussion on importance of mental health. With a competitive world around us, stress, anxiety, depression are very common to happen. But what is more important is that how one learns to manage and come out of it. It is also important that the mental health should not be considered as any stigma and we should be vocal about it. And today is one such opportunity. Let's understand more about the importance of mental health and the science behind why such disorders happen in our panel discussion today. I take this privilege to introduce you to our panelists. Dr. Arvind Kumar is a senior principal scientist at CCMB. His research interest mainly focuses on understanding the epigenetic mechanisms in complex brain behavior and behavioral disorders, neuropsychiatric disorders such as depression, anxiety, and related mood disorders. He uses mouse models to understand how chronic environmental stresses can alter mood and emotions, affecting neural gene activity and circuitries. Dr. Anant Patel is a senior principal scientist at CCMB Hyderabad. He uses carbon 13 nuclear magnetic resonance spectroscopy to study brain energy metabolism in different psychiatric and neurological conditions. The major emphasis is to understand how changes in depression, Alzheimer's disease, and amyotrophic lateral sclerosis brain are manifested in excitatory glutamatergic and inhibitory GABAergic neurotransmission. We have a third panelist as Dr. Pragya Rashmi, who is a consultant psychologist at Yashoda Hospital in Hyderabad and a counselor. She has been closely associated with CCMB and with other major educational and research institutes in and around Hyderabad. She is always ready to provide her guidance and be of any help at all times. Finally, we have our own PhD research scholar, Chavi Davar, who is a PhD scholar in CCMB. She is also a change maker, child rights activist, and a personal safety educator. She herself is an inspiration for many students here in CCMB, and she has never failed to amaze us through all her social activities. To begin this panel discussion, I would like to ask all my panelists to speak a few words regarding this session. We'll begin with Dr. Arvind Kumar.
Hi. So, mental health is really serious issue, not only in India, throughout the world. The epidemiological studies suggest that almost 20-25% people once in lifetime or some point in their lifetime, they undergo mental health. And most common mental health problem is anxiety, panic disorder, and depressive disorder, depression. And you all know when mental disorders go untreated, people can harm themselves or others. Particularly, the suicide is very common. So, understanding mental health problems, understanding what is the neurobiological basis of mental health disorders is very crucial to basically help the people suffering from that. So we use lots of animal models to understand the changes in brain and how those changes, get reflected into disorders of behavior or brain, the neurological and psychiatric disorders here. So in due course, I will be talking more on the findings in animal models because human brain, you cannot open it and understand. So we have to study the animal models to understand what goes wrong in brain.
Thank you, Dr. Arvind. We'll be definitely hearing him more throughout the session. The next panelist we have is Dr. Anant Patel.
Hello, good evening. As Dr. Arvind Kumar has actually mentioned that mental health is very important for human being. Out of these problems related with mind, depression is that very common one, and it actually contributes around 30% of the all mental related issue worldwide. However, for India, it is actually even more. It's a 40%. And if you look at total of people who are affected with depression worldwide, it's around 250 million, more than that one. And the cost for this one is very high. Every year, we have to spend more than $1 trillion to manage these people. And then right now, our understanding for that mental health, actually, there are two major problems. One is that we don't have a clear biomarker which can be measured directly and tell that person is suffering with depression. Another problem is that most of the antidepressants which we have, they are discovered more than 3 or 4 decades ago, and mostly by targeting monoamine targets. And many times these antidepressant takes a lot of time to show that some improvement in person's mood, and many times actually it doesn't show any symptoms. So actually these are very old medicines. We need to look some alternative model or alternative target so that by just giving 1 or 2 doses of that antidepressant, we can improve that mood. So in that regard, really different labs are working, and even we are also trying to do some contribute in this area, and we will be talking this one coming hours.
Thank you, Dr. Anand. We now have Dr. Pragya Rashmi with us.
So at the onset, I think I want to say that I want to differentiate between mental health and mental illness or mental disorders. They are two very different things. Like if we were to be talking, if this discussion was on health, we wouldn't be focusing on, if we were having a discussion on a significance of physical health, we wouldn't be talking about diabetes or heart attack or, chronic illnesses. Exactly like that, when we are talking about mental health, to focus on disorders is great because we need to do that. There is definitely a need, but mental health and mental illness are completely two different things to begin with. There is a lot of stigma that is attached to mental disorders, maybe, but mental health is something that we innately have as human beings, is something that culturally and socially is taught to us as a part of procedure of living. And yes, we are having mental health issues. Mental health issues is your thinking, your feeling, your belief system, your everyday coping ability, your adaptivity to your everyday challenges of life. Life is not easy, it is not perfect, it is imperfect, and how we cope with the imperfections of life and the inability to cope as a human being or as an organism is a disorder, is the disability, is the challenge, right? That is the illness part of it. But in a non-pathological way, mental health is not essentially also mental pathology. They are two completely different concepts, and in my opinion, and and to take this forward, I think there are systems like Sir Patel sir very correctly said that there is a need for alternative systems. There is an economic waste, as we call it, not just in management. When productive hours are lost, when you can't work the whole day because you're not feeling up for it, right? That is not necessarily a mental disorder. That is your inability to cope that day. Something which requires maybe a brief intervention, maybe not a chemical intervention, but a thought intervention where a distorted thought is making you feel in a certain way, and a little correction of that can help you smoothen the path, right? So I think that is where psychologists come in, that is where therapists come in, and there are more than 314 ways of therapy, and there's no one way that works for everyone. Let's take this conversation forward, and I'm sure we'll unravel more.
Yes, Dr. Pragya, thank you so much. We'll definitely get to discuss more about this in our session today. Finally, we have Chavi Davar here, so we'll listen to her about this topic.
Thank you so much. I kind of agree with what Dr. Pragya said. It's more to do with our life skill. And when we talk about mental health, it encompasses our well-being in several ways. How we are functioning that day, how we are able to even get up from the bed or not, how do we feel, and and I think as much as it is a biologist's problem, it's also a humanist problem. It's a human right issue. And with my experience of working with children, I am here to bring on the bench as to what causes mental health issues with children, with teenagers, and how each one of us as part of the society are or have to be part of the solution when it comes to mental health. I think that's where I would drop it. Thank you.
Thank you. We'll begin our discussion now. The first and the most common question which everybody of us would be having is like, what is mental health and why is it important to discuss about it or know about it? So maybe we can start with Pragya. Dr. Pragya, you would like
Sure.
to?
So health, as we understand the old school of thought, health has three paradigms, very simple three paradigms. I'm going the very classical definition of health. Health is your ability to sleep properly. Health is your ability to function properly, as in terms of your bodily functions, physiological and bodily functions. Health is your ability to think and execute properly. Right. So my elderly professors who taught us old school, we used to say mental health is just three things. Mental health is if you are able to sleep properly, if you are able to do what you intend to do. So I intend to do, let's say, 5 experiments today, I'm able to do it. I intend to do, this is my plan of action for the day, and I'm able to execute that. And the third is the ability to live by certain norms, to adhere to certain norms. Having said that, there is obviously going to be deviation. If there is no deviation, then the society stagnates, right? So a little bit of deviation on either side of the curve is fine, which is called deviation. That is why it is not called a disorder, right? So what is mental health? Mental health is being fine physically, being fine psychologically, being fine. What we also, the old definition includes spiritual and philosophical thoughts, right? So that is your belief system and execution of that. So you're sociable, you can talk to people, a certain sociability is there. You are not a threat to self or others. DSH, destructive self harm, or harm to others, right? So pretty much when you're adhering to these 4 5 norms, you are mentally healthy. And mental health, exactly like physical health, all of us don't have the same health, right? I'm sure I'm prone to allergies, you're not. You're prone to maybe stomach issues, somebody else is not. Exactly like that, mental health is something that we need to work on every day. Just like, we are more aware of physical, we don't eat as many puris like we used to eat when I was a child, which is like 100 years ago. So we, exactly like that, society is changing. Our thought process is progressing. Similarly, our mental health thought process also needs to progress. We need to understand, we need to work on it every day. So one small thing that I always say, and I've most of the people in CCMB who are here would know that I keep saying this, that if you brush your teeth yesterday, will you not brush it tomorrow? I gave her assurance yesterday, so why are you not giving it today again? If you are taking care of your teeth every day, dental care is there every day, because it's become part of my routine. Why not mental care? That's my answer.
Thank you, Dr. Pragya. And we have a continuity of the same question. I feel that does the emotional state of a person has to do with his or her mental health? Maybe Chavi or
Yeah, so I believe trauma is very subjective. From what upbringing you come from, what triggers you, all of that encompasses your response to any trauma. So I think as a society, we need to be assuring to each one out there. So each one of us has a different emotional ability, and thus also each one has the deviation that Dr. Pragya mentioned in terms of how we respond to it mentally, right? So I mean, yes, your emotional state has to do a lot with your mental health. And that's where I think it's very, very important that we raise our children with the ability to process emotions in just the right way, that they understand what they're feeling, that we sort of, ensure that we understand what children are feeling. So if we raise empowered children, they are going to be, empowered adults and therefore have better options of mental health, so to say. So we have to raise emotionally emotional well-being in our society.
yeah, even I agree with it that we need to raise them emotional well-being, and we should also teach them to be vocal about
Absolutely.
it and not think
Absolutely.
that it's some type of stigma
Yes.
and we cannot
Yes.
talk.
So what Dr. Pragya mentioned was also about the norms, right? So that brings me to the idea of gendering. Something as simple as crying is so much gendered in our society. Why are you crying like a boy? So that means boys cannot cry. So emotions are there for each one of us, and how we express our emotions need not to be binned into boxes. And therefore, that I think is a very important step when we talk about mental health.
Exactly. We have a next question that what causes depression? Like Dr. Anand Patel.
Yeah, there are many theory for that, and yeah, it's just theory, but people are working on that. But currently, what is known that there are certain molecules which are called neurotransmitters. So, in depressed conditions, the level of the neurotransmitter has been found to be lower. So, based on that one, people have targeted different molecules so that we can boost the level of that. Either we can boost the level of the things in somewhere they can function or entire concentration. So these are like antidepressant I were talking about. They were made based on the monoamic targets. They were actually helpful for increasing the level of these molecules. But unfortunately, when by increasing the level, you can take the some pills, level will go up maybe in fewer days, but you don't see that mood is improved. So there may be like some other things which is happening downstream, which takes more time to activate this one. So in that case, now people are looking alternative pathway, and they are looking actually pathway for like a glutamate pathway. There are some case study in the US, and in fact now it is coming to the clinic, that people who are resistant to most of the antidepressant, and then there is no option, so they have taken that ketamine. Ketamine is generally it's a sedative drug. It is used in that war front when people are uh, wounded and heavily, and then to reduce that trauma and all those things or reduce the pain, this is given. So they will be sedated and then pain will be less. But they found that sub-anesthetic dose, maybe like 1/10th dose of this molecule, reduce that mood, improve the mood of the patient within 4 to 5 hours. But ketamine is like it's a abusive drug, it's party drug, and there are many side effects. So people don't want to use it in long term, but people are trying to understand how ketamine improves that mood of the person. And you can take that idea or knowledge and then develop new molecules which have less abusive property or addiction property and then go ahead. So in that case, yeah, we need to do actually look at the pathway of the glutamate or gamma aminobutyric acid, which can be useful for the improving the mood of the person.
So that means neurotransmitters also have a role to play in anxiety and other depression.
Actually, yeah, I wanted to mention that neurotransmitters are very important for the communication of that information in the brain. If neurotransmission, if uh, if generally there is balance between two types of neurotransmitter. One type is called excitatory neurotransmitter. If their flow is more or communication is more, then our brain activity is elevated. Another one is inhibitory neurotransmitter that suppresses. So somehow, if once this balance is lost, that leads to the different kind of disorder. So major actually like we can target so that we can actually improve the balance between these two pathways.
So effective balance between neurotransmitters is very much necessary to have a good mental health. Yeah. The next question is that what is the importance of research in understanding mental health? Maybe Arvind Kumar.
Yeah. So, as I said earlier, in human we can't do any invasive study. Nobody will allow uh, to poke into their brain or take out the tissue from their brain. So you can't understand what goes wrong in human brain. But you can create those mental illness in animal models, and most used animal models are rodents, mice, rats, and once you create anxiety or depression, it may not be like a human psychiatric disorder, but you may go close to like a psychiatric problem, like in depression. What happens in depression? We don't we develop inhibition to social interaction. Normally anything gives us pleasure, like interactions, we slowly we start avoiding that because now we are not enjoying that. So in depression, we develop loss of pleasure to any pleasure giving stimulus. That is called anhedonia. And in animal models, you can see that if you give them something which they really long for, but when you start giving a stress, and try to induce depression, slowly you see that the things they were liking earlier, like interaction or something to eat, like cheese or sweetened water. Now slowly their consumption has gone down, their social interaction has gone down, which shows that they are developing depression like conditions. So you create animal models for which is closer to human situation, which is really challenging, and still it is not it has been difficult. And then you take out the brain and start studying at cellular level, tissue level, morphological changes, molecular changes, and same way you can also give antidepressants, what clinically people use, and then see while restoring the mood, what are those changes. So once you understand the changes during the development of disease, which is called etiology, and during the recovery, you can understand how brain is working, how a particular molecule or particular target is changing, and how antidepressants are really working. So animal experiments, the models, they are very important in understanding uh, uh, mental illness and in us. Yeah.
I do agree with Dr. Arvind Kumar that how much counseling and other things are important to understand mental health, that much research is also important so that we come to know more about it, and definitely we can have remedies to cure it. The next question we have is from Rajita from YouTube. She is asking that what is better, a medication or a therapy? Like, and maybe Pragya could
Yeah,
answer.
sure.
Yeah.
So I want to state here that a very old-fashioned way of thinking is that there is like a dichotomous treatment approach, right? That either it is medication or it's like, so I personally feel that the approach is more like a railway track. You can't run a rail on one track, which is a better track. It's like saying that you need dono patri to run you need both your tracks. So exactly like that, to say, the previous question, also a continuation of that, is when we are saying that research, biological research, biochemical, bioneurochemical research, when we know that serotonin levels are so important in anxiety and mood, that gives us a base for our counseling, that gives us a base for our therapy. When we tell the patient that have curd in your diet, it will improve your everyday life, which is a very apparently very casual, very frugal kind of a tip, but actually it is a neurochemically backed uh, advice that is being given. So to say that the two are completely different, I don't kind of agree with that. Which is better? Again, if we are talking about mental health issues and mental disorders, again, are very different. Mental health issues is something we've all gone through in our life, or if you haven't, you will. Somewhere or the other, where you will have an anxiety issue, where you will have an issue, not a disorder, right? Where you're going through a phase where you're finding it difficult to adjust to something. Uh, in such times, a brief intervention, okay, which need not be chemical in nature. A brief intervention, sometimes a brief intervention is something as a grandmother patting your back. That is also a brief intervention. It is a socio-cultural intervention, but it's an intervention which equally has therapeutic value. So yes, you will need medicines depending. There is no one answer to that. It's like saying, what can you make out of a potato? Well, there are a zillion things you can make out of a potato. So which is a better approach to treatment depends on the person, the condition, this, like sir said, the etiology of the problem. Everybody has a different mix-up, a different cocktail that's going on. So depending on that, whether you need therapy, whether you need medicine, or you need both. I think that's the answer.
Thank you, Pragya. We have Surbi Rao with a question. She's asking that how can we help someone who is going through trauma, suffering, or depression? Anand Patel, Dr. Anand Patel, would you like to?
Yeah, someone is going through depression, we have to always maybe boost his moral, his or her moral, or maybe some of the major problem here that they are actually they don't like to be associated with anyone, like you mentioned earlier, and they are actually they have lost the confidence. They think that they are always like they are guilty about themselves. So we have to do something so that their morality is little bit improved, and they are more involved with other people. Uh, so that means we should not actually say that whatever you are saying is wrong. Maybe you have to give them some alternative so that they are a little bit happy, and then if they are they like your company, or they think that your thought is also maybe similar to in that way, then maybe it will be good for them, and in long it will not be happen in very like 1 or 2 days. It requires a lot of counseling, and then yeah, I think there, I think Dr. Pragya role may be I think much more compared to scientists there.
So,
Dr.
sir,
Pragya, would like to
sir,
add a point.
so, sir, can we also say that, you know, because the self, like you correctly said, that there is a lot of guilt. So you know, whenever we are talking about distress, I think depression, trauma, and suffering, they are three very different concepts when we professionally talk. So if we put it in one bracket of distress, you know, if you are going through any kind of distress, you are overthinking, you are over analyzing, you are over fragmenting that issue to an extent that you are further distressed. So it's like a vicious cycle that you get into. To break this cycle, there or rather, you know, sometimes it's conditioned learning, sometimes it's called learned helplessness. That, oh, what can I do? It's raining anyways. Every time it rains, I feel terrible. You know, my mood is low when it rains. It's like I have learned helplessness. I've learned I'm helpless in this. So to break this cycle, sometimes a little bit of self development of self, you know, in whatever ways, self doubt, self guilt, self contempt, uh, that is where I think friends come in, that is where I think professionals come in, that is where sociability comes in, that is where encouragement comes in, that is where, you know, the environment's role comes in. I think that is required. So
Yeah,
yeah,
even I agree that if we have a supportive environment or encouraging people, it becomes easy to
absolutely.
deal with
Yeah,
such problems.
yeah,
Family support is must.
Family
Without
support, yeah.
absolutely.
Also, I think
Environmental support.
both of them have said it, but to put it out there, I think if a person who's depressed is coming to you and has entrusted in you, I think the first thing that you need to do is validate their feelings, you know, not just say that it's going to be okay, you're overthinking.
Yeah.
No, I think the first step is to I mean, as a person who's gone through mental health issues, I would have seeked validation that it's okay that you're feeling this. I understand this. Let's talk it through. So I think validating a person's feeling is very, very important when that person in that state of mind.
Absolutely. To add one more line to that, you know, mental health is a buzzword now.
Yeah.
At least last 1 year, even more than 7 months before the pandemic. So somewhere the moment we are all aware of depression, thanks to whatever has happened, we are all aware of depression. We know depression is something that is there. But so the moment somebody comes and tells you, I am depressed, that person is depressed, you are now anxious because, oh my God, what do I do? You know, so the first thought in your head is, oh my God, I've just heard of somebody having depression. Depression is a real thing. Oh my God, oh my God, oh my God, what do I do? So the first thing is, do not panic yourself when you hear of someone having depression. I think that is essential. Be calm. Don't let that other person know, oh my God, you said something dangerous to me. So I think we should start there.
Yeah, we all agree with you, Dr. Pragya. We have our next question by Siddhant, who is asking that why do certain mental health disorders such as schizophrenia is more prevalent in some families? Maybe Dr. Arvind Kumar can.
Yeah, so schizophrenia is most complex psychiatric disorders, and uh, many psychiatric disorders, schizophrenia is also genetic, but not always genetic. In some cases, there is a genetic link. So some families, you can see depression or schizophrenia, but most of the cases are not genetically linked. Most of the cases are environmentally induced. Yeah. there may be some genes in some families or some genes in some individuals which may be susceptible to environmental stress. They may not be able to cope up. And once enormous amount of stress they go through, they start showing symptoms here. So it's not always genetics. There may be some susceptible genes, but most of the time it's sporadic, non-genetic. It has been found. And now we know that how environmental stress can induce even in normal individual, these sort of symptoms when they go through lots of stressful episodes. And in animal models also we have shown it, and this is what is called epigenetic mechanism. So any environmental changes which affects your uh, genes to behave differently, either it silences your genes or it overactivates a particular gene, and your circuitry changes, you start showing symptoms, you start showing mental illness condition. So environment, how environment affects your genes to behave differently and induce these sort of things, they are called epigenetic. The good news is the epigenetic changes do not changes your gene sequence. They only changes how your gene expression gets affected, and it is reversible. So if you are going through therapy, whether it is psychotherapy or keep or medication, your epigenetic changes reverses. Even in animal models, it has been shown that if they are treated or if they are giving good environmental enrichment programs, the epigenetic changes reverse and they start feeling better. So it's not mostly it is environmental. Little bit there is genetic connections.
Thank you, Dr. Arvind. The next question is what can be done in schools and colleges to promote mental health among students? Like from students, young age is important to promote mental health. So what can be done at the school and college level? Maybe Chavi is the best person to answer this.
Yeah, so let's first understand the general psychology of a child. Okay, so for children, everything is sensitive and emotional. A puppy crying on the road could make them feel very sensitive. So I think when we talk about children in a very age appropriate way, we need to bring in the concept of mental health. Talk to them, tell them why it's okay to feel sad on a day and feel happy on the other day. Validate their feelings, as I said before. And also, I think schools need to be a very safe space where every child can just come out and talk about how they are feeling. And that can only happen if we are addressing the issue first. Also, when children are growing up, I think there are a lot of issues that can affect their mental health, be it issues of gender based violence, be it issues of bullying, be it issues of body shaming, issues of two friends, best friends fighting could be, an emotional trigger. So I think talking to them about all these issues in a positive way and having an ear to listen. So kids, I think children are the only individuals on planet Earth whose rights are neglected to the topmost extent. And so, just somebody to listen to them, to validate how they are feeling, I think that's a good start for teachers and parents. Talk to them, is what I would want to add here. Yeah.
I agree, and schools should definitely teachers play a major role in
Absolutely. And we've seen schools that have counselors there on the desk help. So kids just feel like going and talking to them, even if it's something very simple, right? So a person accessible there to talk about how they are feeling helps.
A kid like here spends equal amount of time in school as much he or she spends at home. So
Absolutely.
as much as family, even the teachers and the school environment is very much important in such conditions. Surbhi is here with another question. She's asking that is depression and autism related? Dr. Anant Patel can answer this.
Yeah, I think depression, autism, this is both of them are kind of a problem of the mental health. But autism is more related with developmental problem. So many times, environment play a lot of role in our development. So when actually this child is developing in the mother's womb, that time if there is some unusual chemical is there, and that is triggering some pathway of the development, and because of that, actual growth, normal growth has not occurred, and that will lead to that some other problem in that person once it become maybe teenage or even later age. In fact, we have done one experiment in a mouse recently. It was published in eLife. There, some pathway related with activation. And that this one was done in when the pups were from 2 months to 2 days to 14 days. And when these animals were looked after 3 months, they were found that there are a lot of anxiety, depression problem, and then they are also showing that symptom like autism or schizophrenia. So this is more related with I think development.
Developmental.
Yeah, I want to add.
Doctor.
So in recent epidemiological studies, looks like there are indication that if mothers during their pregnancy, if they are exposed to stress, if they are showing anxiety or depression, or if they have inflammatory disease, viral induced or bacteria induced, the fetal brain development gets affected, and maybe some proportion of autism spectrum disorders. Autism spectrum disorder. It has so many different spectrum of disorders. So some proportions of those disorders may be linked with maternal immune activation, maternal depression, and maternal condition during the pregnancy.
Thank you, Dr. Arvind. That was a good information for all of us. We have a next question that what are the side effects of stress on our physiology? So Dr. Pragya would like to answer it.
So when we are talking about physiology, not that I am the best person to talk about neurochemistry, absolutely not my area of work. But having said that, neurochemicals, whether it is norepinephrine, whether it is serotonin, whether it is dopamine, clearly have an indication on our mental health. That's a done and dusted research that everyone knows. So to take care of there is a way in which we can enhance our neurochemical health, right? Our neurochemical well-being, what we call it, what we are now calling mental health hygiene. Okay, so something like your diet takes care of your serotonin level, because serotonin is one of the neurochemicals which is most diet friendly. When you do a pleasurable activity, you are having a very stressful day, but you are sitting and you love to color, you are sitting and coloring, you like to listen to music, you're listening, so it's adding to your neurochemical health, right? It's your well-being, it's increasing, it's giving you that how should I say, that up that you require, whether it is your serotonin, definitely for mood and anxiety levels, whether we are talking about dopamine, whether we are talking about, and like sir very very nicely sir explained, of course I wouldn't be able to go to that depth, but I can definitely say that when we are talking about dopamine hypothesis and mental disorder, right? Okay, like when we are talking about schizophrenia, we are finding that when we are taking care of dopamine in a regular normal everyday life way, we are able to enhance, or we are able to take care of that. When we are like diet, like exercise, like activity, like pleasurable activities in your whole day. So yes, does I think the question specifically was, does stress affect physiological well-being? Yes, stress affects physiological well-being, that is for sure. But how do we combat that? Because there is going to be stress. What is stress? Stress is any conflict, right? And we are living in an urban society. We are not, nobody is living in Himalayas, nobody is living in a perfect society, so there will be stress. So the question is, how do we combat this in our everyday life to deal with this imperfection? Is that answered, or do I take this further?
I think it's very well answered, Dr. Pragya. Thank you so much. We have a next question that how does stress and headache is related? Is there any relation that because of stress we get headache or something?
From the little psychiatric experience that I have, I would like to say that bipolarity and migraine, there are studies to show. Sir, Patel sir, have I got that right? Sir?
No, yeah, please continue.
So I think I've, bipolarity and migraine headaches. Headaches associated with, sometimes in autism, we find certain specific kinds of, not just autism, like sir said, in this whole spectrum, there are certain kind of headaches which are there, chronic pains that are associated. So yes, which comes first? Does the headache lead to this, or is it a symptom of that? Really, I'm not the right person to answer. Maybe sir will throw more light on that. Arvind sir.
Yeah, so basically, whenever people have anxiety whenever they have a stressful episode, you go, you start feeling different types of pain. So normally, if it is acute, then it may not. But when it is chronic stress, then your physiology is changing. And some of these pain receptors and other things also, people have shown that they get affected. So you may have different type of pain. It may not be just headache. It may be other bodily pain. Uh, yeah. One question I want to answer that physiology and stress. So now people have a strong evidence that daily life stress not only directly affects your mental health, uh, they affect your metabolism, and you may develop metabolic syndrome. And particularly, this happens when you are sedentary, plus you have a stress. So sedentary lifestyle, when you are eating good calorie, lots of calories, but you are not burning it. And then somebody asked about the sleep and mental health. So what happens? This modern lifestyle, everybody is trying to catch up so many things in limited 24 hours. We don't have more than 24 hours. So we after our office, after our school, we are always trying to catch up, going to internet, going to different sites, doing so many things, watching TV, and finally we are delaying our sleep cycle, and disturbing the circadian rhythm or sleep cycle has direct effect on your metabolism, and metabolism can trigger lots of things in brain. So this metabolic disorder can lead to the obesity, diabetes, type 2 diabetes, can lead to changes in brain and can induce anxiety and psychiatric problem. So all these things are connected. So basically stress, sedentary lifestyle, we have to somehow deal with it. And circadian, so like clock knockouts and other genes, which regulate your sleep rhythm, they have shown that how it affects your mental health. And yeah, there is one NPAS, molecule, nuclear pass domain. So if you knock it off, so you have depression and other types of symptoms in animal models. So all, and that links both your metabolic cycles as well as your, it plays very important role in brain. So maintaining good, a like physiology is very important to maintain good mental health.
I also agree that nowadays we are facing so many problems. It is mostly lifestyle associated problems, which are not there previously, but today, because of the lifestyle which we are currently living, or because of our lifestyle, majorly these problems arise. I agree. Sabi, would you like to add upon it?
No, so I think stress and physiology go hand in hand. So you have to have a healthy lifestyle to keep stress at bay. And if you have stress, of course, it affects your physiology. So it's proven both way, right? So it's sort of a balance, yeah.
So something like stress also we can have a counseling for it, or
Yes, I think talking it through always helps. Talk it through with your family, with your friends. If it's not, then we have experts like Dr. Pragya. So yes, but I think having a balanced lifestyle takes care of most everyday stresses. Yeah.
I do agree.
Yeah, particularly exercise always helps.
Yes.
Yeah, so if you do lots of exercise, you produce in brain lots of good molecules, like endorphins and other things that reduces your pain, your and it improves your mental health. Yeah.
Now, when you're talking about brain and neurotransmitters, we would like Anand Patel to add upon this. What do you think about this?
Yeah, I just wanted to add that stress for short time, maybe few days or a week, is not bad thing. Or showing someone like showing emotions, it's not bad thing. In fact, if someone is not showing emotion in some difficult time, in fact, that may we may consider that that is a normal thing. So these are the kind of normal thing. But if it persists for longer time, then it will create problem in the person's life. So we should think that like certain problems or certain emotion related things should not continue in particular person's life for longer time. If they is there, then maybe and it persists for maybe month, then we need to look at an expert like Dr. Pragya or others clinical person.
Even I think that stress and all is very common with nowadays, but the important thing is how do we come out of it? We need to take some measures so that we are out of it and we have a healthy mental life. So we have Stuti from MS Teams who wants to ask us a question. Stuti, can you please unmute yourself and you can ask your question now?
Yes, thank you. So as a high school student, I see people trivialize and reduce sensitive topics such as suicide and mental illnesses to jokes, and which sort of inevitably increases the stigma around mental illnesses. So how can we battle this?
Maybe Chavi can answer it better.
Yeah, so I absolutely agree with you. So it's now become like a slang. I'm depressed. I'm suicidal. So I mean, it's important that we talk about these issues with utmost sensitivity. I think media has a very important role to play here. I mean, we've seen in the last few months around Sushant Singh's death and how things have been just, advertised in a way. So yes, I think the role as a student, as a child, I think you can't really do much. But as an adult, as somebody of the school administration, make sure that these topics are brought to the children in the way they need to be. These are sensitive topics, and we need to talk about them in a sensitive way. Because when I joke about depression and suicide, there might be a person in the audience who is actually going through it. And so, therefore, you are not only invalidating that person's feelings, you're also making that person just not being able to talk about it to anyone because you've joked about it in a way. So I think each one of us has to be very, very sensitive, more so adults and trusted adults in the periphery of children, because that is very, very important. So thank you, Stuti, for bringing that up.
I think it's very well answered. A similar thing we have is nowadays we have a new term called as teleneuropsychology, which means that we can use audio-visual technology such as videos or any other TVs can be a mode of it to reach people who are in remote areas. So, what I would like to listen from the panelists that how effective you feel that this therapy is as compared to physically meeting the patients and giving counseling. So, we would like to start with Arvind Kumar.
Yeah, so basically, like in pandemic times, telemedicine is working. Uh, uh, in people who are suffering from mental problem, they normally do not like to go to psychiatrists because of taboo in the society. So I think this may be much helpful if they connect to a psychologist or psychiatrist, and they open up and get help because they don't have to visit their clinic. I think Pragya will be a better person to
So I would like to share my own experience. With all modesty, I say that I've been working for nearly 20 plus years, and I'm from a non-digital era of education and work. And when I was given this option of telemedicine, I vehemently refused. Okay, and I absolutely did not do it till almost, let's say, mid-April. Okay, and I chose to go to my clinic at the cost of all the risk because I did not think that you can have an empathy relationship, a bond, that a touch, when I hold my patient, a touch that can be done over a digital medium. But having said that, when I started doing this, and I started doing this with utmost reluctance, let me tell you this, and almost because I had to earn my bread and butter. But when I did it, it started with 16 people a day, 17 people a day. It was overwhelming. And it was just overwhelming, I'm telling you. And even as I talk to you, the reason you see me all set up here is because I have this would not be possible. Having said that, that's the positive side of it. People don't have to step out. A child who can't come out, I don't want the child to come to a hospital and be vulnerable. I can do this online. This is brilliant. The flip side of it, I see a woman who is talking to me in whispers, and I have a protocol because obviously it's an audio visual medium. I need to hear, I need to see, I need to see your eyes, I need to see your facial expression, I need to read your body. It's not just about what you're saying, right? It's just not about venting. So wonderful thing, woman is talking to me, I can't make out what she's saying. Please be louder, please be louder, please be louder. Then I realize she's talking from the bathroom, because that is where personal space is in our society. So a man wants to talk to me, he says, will you be very punctual? And he's absolutely worked up about the punctuality. I realize that he has stepped out of his house because he wants to talk. So personal space, newer things are coming up. We've seen the rise in domestic violence. We've seen how families are, elderly people are erupting, younger children are erupting, teenagers are erupting. It is definitely questioning our community system. It is definitely questioning our society system. So if it was not for the telehealth, this would never have come out in multiple ways. How we are what should I say, the fragmenting of so many of our social systems. Yes, so does telemedicine work? Yes, it does. Is it the best option? No, I would still prefer to hold my patient's hand.
Yeah, even I agree that teleneuropsychology is like something which we have is good for people who cannot reach out to us. They have a medium to talk to us in places where this is still considered as a taboo. So people from there can reach out to us through mediums of audio and visual and other things. Chavi, would you like to add anything?
I think she said it beautifully. I think where it has helped us in the last few months is cases of domestic violence and child sexual abuse, where the Child Protection Committee could not physically go to the child's house, but then we could offer the child the help that is needed via tele counseling. And so I think in such cases where the perpetrator and the victim is in the same space, it has helped tremendously, and it has opened doors for all of us in the sector. I think she would agree to it. But yes, I agree. The way you have to empathize, the power of the touch, and to be able to read the other person's body, that is something which is a restraint in that. So
I do agree. We have question from Chaitanya from YouTube. He is asking that scientists measure anxiety, happiness, activeness, etc., and all other emotional factors in animals, and they use it as model organisms. But it also means that animals can't speak like that. So how do we measure?
it's a nice question.
Can I take that? Yeah, so you are right. We measure different parameters of mood, of emotions, and we say that the animal might be going through anxiety-like. So we never say anxiety or depression in animals. We say anxiety-like, depression-like, because they cannot speak. We can't give them questionnaire and they can answer. Yeah. So we have to. So what happens? Like I told you, in humans, we have seen that if they are going through depression, they start avoiding social interaction. They go close themselves in their room. So if you see behavioral change in any person living around, particularly if they don't want to interact with you, it means they have some issues, and you have to approach help. So in animal models also we see that if they started avoiding interaction which gives them pleasure, everybody wants to interact, social interaction gives pleasure. Similarly, if you give them something other than their regular food which they really enjoy, like cheese or sweetened water, they will take more that thing than other routine food. And you can see that when you start giving them stress and they induce anxiety or depression, slowly and slowly they reduce the consumption of their favorite food. So the reward which was motivating them, now it is going down. So what we call the developing anhedonia, loss of pleasure to pleasure giving stimulus. And that's how we model them. We cannot exactly say they are undergoing depression, but seeing their reaction to their all these things, we can say that they have depression like or anxiety like conditions. Yeah. This is the best we can do with animal models. Yeah,
I agree that animal models cannot speak, but they do indicate us with some ways that they are feeling like they are happy or not. And I think Anand Patel can add upon this.
Yeah, I don't have to add, but I just wanted to mention that animal can't speak, we cannot say. They may be speaking, but we are not capable to understand what language they are using. So there is always some behavior or some language there, and only what we are assessing them by doing their behavior, maybe their pleasurable activity or interaction and all those things.
So yeah, so in mouse and rats, now people measure ultrasonic vocalization. So when they are normally, and now they have the pattern. When they are normal, how they vocalize. when they are in a stress or they are showing anxiety, what is their pattern changing? So that is also one of the major, since we don't understand their language, but that ultrasonic vocalization pattern is giving some idea whether they are going through something here.
We have a question with the recent pandemic which is going on, that what psychological impact does COVID-19 have on patients? We would like to hear from both the aspects. From the research point of view, that is something research has proved that yes, there is some psychological impact on the patients, and through counseling and other things. Like, have you counseled some patients who have gone through this? So we'll start with Dr. Anand Patel.
Yeah, so this pandemic thing is not usual. It's very unusual, and we are always, like, when we are in unusual condition, we are always in stress condition. Like, suppose, like, there is a lot of problem. Like, many people are losing their job, so they are having stress for the money, or you are just contained in one room. You don't have to go out, okay, because you have to avoid the contacts and all the things. That is another stress, and then anxiety and stress will develop a lot of actually problem in the depression. So all these things are actually creating actually many people who are generally earlier maybe normal, maybe having problem related with brain. So yeah, it will have, I think, huge impact. In fact, the impact of this may come even later also. Like, right now we have gone through that one, so we are not assessing, we are not seeing going to the hospital. Very few people are going to the hospital. Once things are open, then we will see that impact of this one. But I really I feel that there will be huge impact of this one on even health of the normal person.
So, is there certain research which has proved this, Dr. Arvind Kumar? Are there certain evidences to prove that COVID-19 does impact?
Means people infected with COVID-19,
yeah,
or
like
just
people recovered from COVID-19 do have a psychological
yeah.
issue.
So there are reports coming that they have neurological issues. Still, we don't know psychiatric issues, but many neurological conditions are coming, and it is because of the COVID-19 induced neuroinflammation. And COVID-19 also seems to be precipitating the clots inside the vessels, whether it is lungs or whether it is heart. And so the oxygen supply to the brain, maybe they are getting more hypoxic, and that has implications for brain neural function. So there are reports that serious neurological consequences are there in people who recovered and people who are recovering from so there will be long-term consequences for mental health too.
Yeah, there are reports in the children that like they have, even children are getting stroke, but again there is conflicting reports, so they are depending on the maybe that health of the person will have different phenotype and all those things. So yeah, it's not very clear that whether it is because of COVID or some other thing.
Savi, would you like to add upon?
Yeah, so I can't say about has COVID-19 infected and treated people having any, but then COVID-19 as such has left us all stressed. See, we are all social beings, right? We need human contact, and COVID has set us in a very isolated position. And given that isolation, if there is also added violence, or if there's added trauma in the family, or there's disturbance, then that of course has led to stress and depression and also self-harm in children. And here I mean, there are kids out there, so we all say that our lifestyle is disrupted, but we need to, as parents and teachers, keep in mind that the lifestyle of our children are also disrupted. They're not going to school, they're not getting to talk to their friends, there's no social playing together and being together. So it's even stressful for them, and sometimes we forget that. So let's just keep in mind that COVID-19 is stressful for our children as well.
I do agree. And Dr. Pragya, how do you want to add?
I think what I would like to add here is, I don't know much about the virus. The studies are too early in their, it's too early in the studies to be talking about psychiatric and mental health effect. As Patel sir perfectly said, that it's going to be multi-channeled. Okay, it's not just about what is happening now, it's what will happen 5 years later, what has happened to, let's say, a particular kind of disorder in this situation. So those are things that only time will tell as studies mature. But having said that, the impact of COVID-19 on society and on our minds to the non-virus effect, as I like to call it. So the first thing it has done is it has taken away time tags. So we were all living by time tags. 9 o'clock I send my child to school, 10 o'clock I go to office, 11 o'clock I do this. So our body rhythms, whether it was our physiological rhythms, our psychological rhythms, we had time tags. Everything was attached to time. Now physicists will tell you there is nothing called time, and this pandemic actually did that. It took away time from us. So the first thing, it left us all anxious. So WHO says there's a 18 to 24% increase in anxiety levels all over the world, even in people who were not in the anxiety disorder zone. So what happened? What happened is we are left without that base, the time base that we were holding on to. If we had escape routes, just going to your, we were not living in a perfect world. So when people talk about new normal, Purana normal, I'm yet to understand the old normal and how well we were adapted to it. I'm still coping with the old normal. Most of the people I knew were coping with the old normal. So this new normal and its adaptivity, I don't know. It seems like too much to have thrust on my already overloaded head. We had escapes, going shopping, buying pani puri, eating pani puri, just talking to a friend. IT industry had those sutta breaks that they used to take, or a tea break that you took, or just hanging out. Those are all gone. So your dealing mechanism is gone. Your base of attaching yourself, identification base, that is time, space, that is gone. So obviously you're left very shaken. Just normal everyday human beings. You don't know how to cope with things anymore. This is something, almost everybody living on this planet has never seen anything like this before. So it is something that we don't have a frame of reference for cognitively, right? So we are completely, it's very, what should I say? It's a mother's womb kind of feeling. We don't know what to do with what. And imagine, how are we dealing with our interactions then? When we are so shaken up, how are you dealing with your spouse, with your boyfriend, with your girlfriend, with your teacher, with your maid, anybody, any of your social interaction? They can't be normal. How are you dealing with your children? What is the model you are providing for your children? So yes, the entire base of human psychology is definitely shaken up. So if that base is shaken up, how are we coping with it? I mean, what is the impact? The impact is like an earthquake. Only when it stops, we'll know how shaken are we. Correct?
I completely agree. Yeah, right. We are towards the end of our session. So I definitely feel that all our viewers would be really benefited by this session, and we all now understand and have an idea that how important mental health is, researching about it, and even enlightening this topic among the common public is very much important. To end the session, I would like to ask each of our panelists to give a take-home message for all our viewers. We'll start with Dr. Anand Patel.
I mentioned in the beginning that we have two major problems for the depression. One is that we don't have any molecules or any markers which we can measure and tell, okay, this person is depressed or anxious. So we need to do more research in that area to do that one. And then if you do that one, during this process, you will understand what is happening really in that depressed condition or anxious condition, which molecules are overexpressed or underexpressed, and then find that other novel molecules so that we can very quickly correct it. Because most of the antidepressants which are working used now, they are very, very slow at working. So we need to do a research in this area, and maybe government or other people should actually invest more resources in that area so that we should have a antidepressant which is faster acting, not very slow acting. Like if starts showing symptoms in a month or 2 months, by the time the person who is taking this medicine, they give up. Already they are like confidence is very low and they think, okay, medicine is not working, I don't need to take.
So research is very much important. I do agree. Dr. Arvind Kumar would like to add upon.
Yeah, I think we should come out of the taboo. We shouldn't think that people will laugh or whatever society says. Basically, we don't have to worry about that. We have to help ourselves, and and this is not with just everybody in their lifetime, they go through some phase in their mental health problem, and it can happen with anybody. Yeah, so we shouldn't feel inhibited, and we should seek help. We should be open up and discuss with the family and friends, and we should get help. Yeah, this shouldn't be a taboo, particularly when uh, now we know that like physical health, we go to doctor. For mental health also, we need to go to a specialist and go to those who can provide the care. Yeah.
Thank you, Dr. Arvind. Discussing, attending a counselor and talking more about it is really very important to come out of it. Chavi, what would you like to add upon it for our viewers?
So yeah, I mean, you're not alone. Each one of us goes through it at some point of time in our life, and so there's no shame, as Dr. Arvind said. Talk about it, talk it through, and seek help. I think seeking help is very, very important, and be there for each other. I think one thing that the pandemic has taught each one of us is that there is certain problem in the fabric of our society, and so I think we need to be there for each other and be available to each other.
Thank you, Chavi. Dr. Pragya, would you like to?
So my 2 bits is, of course, if you are disordered and you think that you're not able to cope with it yourself, do reach out for help. Professionals are there. But having said that, my take home message is only two. Before you reach out to anybody else, connect with yourself first. Be your own friend. It is so important that you become your own friend. You listen to yourself. Don't, we are trying to escape our problem. We are trying to escape our pain. Escaping is not going to help. Look within, do an introspective study, do an spend time with yourself. One of the key thing is people want to avoid. They want to surround themselves with people, not from a therapeutic way. They want to surround themselves so that, they can get rid of it. Somebody else take this responsibility. No, first and foremost, you take up your own responsibility. You understand something is not okay. You help yourself out. You try to get your own insight. Read up, reach out, do whatever. And second of all, understand it's okay to be not okay. It is absolutely okay to feel sad. It is absolutely okay to feel annoyed, to feel angry. These are all human emotions, and it comes in our manufacturing. It is not something you're doing intentionally. It is not something that you need to be ashamed of. It is absolutely okay to have negative emotions inside you for a while. Please accept it. There are no norms. Don't go by somebody else's norm. Do not compare your life with someone else. It's not valid. It's like comparing an apple with an orange. Please do not do that. Don't look at Facebook and think that everybody is so happy, I'm not. Everybody is traveling, I'm not. Everybody is rich, I'm poor. Please do not do that. You do not know the picture behind the picture. So please be very introspective, look within yourself, and be okay with not being okay. It is an imperfect world. Let's not aspire to be perfect. I think we'll all be happier that way.
Yeah, and very rightly
Yes,
said.
thank you, Dr. Pragya. I think you have very rightly said about this entire session, and it would be a very good take-home message for all our viewers over here. I think that all of us would have gained something useful from this session, and all our viewers would have enjoyed this session. I would like to thank all our panelists for giving us time and being present here.
Ma'am, may I take this one moment to remind everybody in CCMB that we have a mental health service available, and if anybody in CCMB wants to reach out, we are available.
Yeah. Dr. Pragya is always available for us. Please reach out to us. And I would like to thank all our panelists for being here for this wonderful session. I would like to end the session by a quote from J.K. Rowling. She says that happiness can be found even in the darkest of the times, only if one remembers to turn on the light. Thank you very much. Please do fill in the feedback form and let us know how was the session. Thank you.
Thank you, Sada.
Thank you, sir.
Thanks,
Thank you.
Thank you, sir. Thank you.
Okay, bye.